Hello, my friends, and welcome to the Pathway channel. Today we will discuss the basal cell carcinoma. Just few points about the basal cell carcinoma. So it's the most common cutaneous malignancy, and it has an excellent prognosis with local excision. The risk factor, chronic exposure to sunlight or ultraviolet exposure, radiation exposure, or it can happen in immune suppressed patients. And here I will just go through this slide with you. Now we are at the 2.5x. And as we can see here, I will just go through a very brief description about the skin. So we have here, this is the epidermis with all its layers and the basaloid layer that we will explain later on the high power. Then we have the dermis, which is composed of the papillary layer just beneath the epidermis and then the reticular layer. And we have all the skin appendages in this area with the sebaceous glands with hair follicles. And here, this ink is to mark our deep margin. In case we have any invasion, we need to know whether, or we have an invasive carcinoma, we need to know whether it's invading, the margins are clear or not clear. So we'll just go at high power. This area is considered like normal. No basal cell carcinoma is shown on this piece of soft tissue. And just to let you know, this is the hair follicle, and this is the sebaceous gland with the hair follicle. This is just some inflammatory infiltrates of the skin. This is another hair follicle, and let's go, or let's navigate through this, and I will show you now another piece here. It's from the same patient, of course. And again, if we moved from this direction to this direction, we will notice that we have some weird mass or lesion that will appear. So this area here is just the same normal skin with the epidermis and the dermis with the hair follicles and the sebaceous gland and all the skin appendages. If we moved on this area, we will notice this lesion, and this lesion we'll go see it at high power. But from the low power, I want you to recognize some features of the basal cell carcinoma. The first thing is what we call the stromal retraction. So we will have the basal cell carcinoma like here, and then surrounded by this white gap, which is the stromal retraction. This is characteristic for the basal cell carcinoma. And here you can note the same here. Also, you can note this very white gap. Again, here it's more evident. This is what we call the stromal retraction. I want you to notice another thing which we will go at high power and view it better, which is the palisading. So you will find the basaloid layer, which is a proliferating one. It's forming kind of a fence surrounding this lesion, and we'll go see it better on a high power. But again, if you can appreciate it on this power, it's kind of a fence. It's more darker even, and this is another character of the basal cell carcinoma. We'll go at high power and see more features. So this is the high power of the same tumor, and as you can see here, what we mentioned on the low power, the stromal retraction. Here, it's more evident on this high power. We are now at 10x, and the palisading that is surrounding the lesion. And this tumor is a hyperchromatic tumor with scant cytoplasm. See how it's coming into the dermis, and all the cells here, they are hyperchromatic. Again, here you can appreciate this palisading, and you can appreciate the stromal retraction that is surrounding the lesion. This is some skin appendages. This is the dermis, some adipose tissue. I just want to show you another feature. This is what we call the solar damage that happened. So you will find here difference in color between this red color reticular fibers and this grayish one. This is what we call the solar damage that happened, and this is a sign that this patient was exposed to chronic sun or chronic sun exposure. These are sebaceous glands. This is a hair follicle with its sebaceous gland attached to it, evacuating all its sebum into the hair follicle. And here the margins, here is a margin, so it's a clear margin. And we just have the basal cell carcinoma located in this area. So this case was diagnosed as a basal cell carcinoma with clear margins. Thank you for watching the video. Please like and subscribe.